inspirational conversation about the great work happening at Parkland Health. My name is Michael Horne. If I have not had the privilege of meeting you, and I serve as the President and CEO of Parkland Health Foundation, really just excited to be in a space where we continue to advance the mission of our organization, which is to secure substantial philanthropic investments to advance the mission and great work of Parkland Health across Dallas County. It truly is a community endeavor. And so for that, thank you all for being here, for taking time out of your busy schedules to join us for a celebration, hopefully some education, and also inspiration to be a champion and advocate for the great work happening in our hospital system. This evening's conversation really is going to focus and allow us to dive into Parkland's innovative approach to cancer care and how, as a community, we can come together to support our patients that may be currently receiving care at Parkland or may receive care into the future. We're going to highlight the innovative cancer care approach that Parkland has adopted, describe advancements in treatment options, and discuss efforts to expand outreach and address healthcare disparities that we know exist and are well documented here in Dallas County. Now, I and certainly we at the Foundation are especially appreciative of the tremendous and ongoing support that you here in attendance have provided to the work that we're doing, ultimately enabling Parkland Health to provide preventative care, compassionate care, and treatment to patients across our vast community. Now, a couple of housekeeping items. Later in the program, you will see on the screen a QR code. We're trying to be more innovative in the spirit of innovation, allowing you to submit questions that you may have for our panelists who I'm going to introduce shortly. And we're going to do our best to address as many questions as possible following the panel discussion to really make this kind of a rich and robust discourse. I'd also like to take the opportunity to thank our valet sponsor, Park Place Motor Cars, for supporting tonight's event. So please join me in showing them some appreciation. So now, before we begin and I bring our panelists up to the stage, if you will, I want to level set our conversation tonight and provide some general kind of framing context that I think is going to be helpful for how we make sense of the discussion and ultimately really ground us in what I know is going to be a thought-provoking evening. Now, according to Parkland Health's most recent Community Health Needs Assessment, or CHNA, for those who are familiar with what is a required inventory or assessment of health need across our catchment area, which is Dallas County, cancer is the second leading cause of death in Dallas County. Furthermore, the prevalence of cancer across Dallas County is highest among those 65 years or older. And in fact, there is a higher incidence of cancer for non-white Parkland patients. Lung, breast, and colorectal cancers are the most commonly diagnosed cancers in our community. And often we know that Dallas residents lack access to preventative and really important screenings and face later stage diagnoses while struggling to navigate the kind of various barriers and complex barriers that exist to receiving the appropriate care that they may need. And so with this context in terms of what we're facing, what we see, I'm excited to introduce the panel that is really going to help us dig a little deeper into the challenges that we know exist across Dallas County. But again, the innovative approaches that we are taking to provide life-saving interventions to our patients here at Parkland. Dr. Navid Sadeghi is the Chief of Cancer Programs at Parkland Health. He's a board-certified doctor in hematology and oncology, specializing in breast cancer, leukemia, and lymphoma. Dr. Sadeghi's work focuses on improving cancer outcomes, advancing care delivery, and addressing health disparities in underserved communities. Please join me in welcoming Dr. Sadeghi to the stage. We're also going to be joined by Susie Marshall, who is the founder and executive director of Grow North Texas, a Dallas-based nonprofit cultivating healthy food communities by strengthening local food production and improving access to fresh, nutritious foods across the Dallas area. Susie has spent 21 years of her experience working with food systems, food producers and food assistance programs, distributing surplus fruits and vegetables across the community. Susie serves on several boards and committees at the state and local level, including Parkland's own Patient and Family Advisory Committee. Susie is also a cancer thriver and a current Parkland patient. Please join me in welcoming Susie to the stage. All right, binders, cards, thank you so much. Also want to thank our wonderful Parkland Health Foundation team that many of you had a chance to interact with, helping to make tonight's conversation possible. So to get us started, Dr. Sadeghi, I want to start by asking you to kind of give us an overview, if you could, of the cancer program at Parkland, kind of what sets Parkland's approach to cancer care apart from other health systems that exist here in the local community, and how does innovation play a role in improving outcomes in what we see here at Parkland?
Thank you. I just want to start by saying, and I'm not into politics, but in a time where the national headlines are about cutting funds and how to do less, it is so invigorating to see how the community comes together to see how we can do more. So I really appreciate that. It's a privilege to be here and talking to you guys, and on behalf of our patients more than anything else. So Parkland Cancer Program is essentially what we have been trying to do is bring as many cancer disciplines that are involved in the care of the patient into one location. So basically a cancer center without naming ourselves a cancer center. But bringing everything together, so instead of patients running between buildings to receive care, at least they would have like a medical home, a place that they can identify, that they can go to and receive the care that they need. So essentially, the majority of our services, and hopefully you guys would have an opportunity to look around and see, is on the first floor. It's our boutique center for breast health, and the rest of our operation is on the third floor, where our medical, surgical oncology, palliative care, oncology, behavioral health, and all other services that are involved in taking care of these patients are co-located next to our infusion center. I think the part about the innovation that you referred to is it's for many places there is a recipe on how to provide care to the patients, and those recipes often do not fit the patient population that we serve, and this is where it comes down to we need to find a way that fits our patient population and our needs rather than just copying what is being done everywhere else. Now, I'm happy to give you a couple of examples about this. So a significant portion of our patients are unfunded, uninsured. These patients historically, for their health care, the place that they go to first and foremost is the emergency rooms. So when they come, they're diagnosed with cancer, they're receiving cancer care. When something doesn't feel right, their natural thing to do is just go to the emergency room. And we recognized this a long time ago and decided that, okay, we need to build an acute care clinic within our area where patients, when they have uncontrolled symptoms from the treatment that we're giving them, they can come to right there and then receive care that they need instead of go to, by the way, if you don't know, our emergency room at Parkland is one of, if not the busiest emergency room in the nation. So instead of going there and just sitting and waiting for the care, they come here, they receive the treatment, they go back home. They have the opportunity to touch base with their physicians or advanced practice providers that work with the physician team to take care of them. A couple other examples that I can give you is that, so for care of colorectal cancer patients, in particular rectal cancer patients, there are different ways of doing this. One is that when you resect the cancer, patient essentially loses the function. It's like losing an organ. And they're gonna end up with a colostomy, and it affects obviously their quality of life. There's a different way of doing this. Some of these patients may not require surgery, but that means that they would require to have close clinical surveillance and monitoring. And this is something that I want to highlight these efforts because this is actually interventions that have been funded through philanthropy. So through a grant from McKesson, what we did is that we developed the necessary infrastructure for clinic-based flexible sigmoidoscopy. So when the patient comes here to see their surgeons, they have the opportunity to right there and then have a flex sig and see if everything looks good. Another example would be that when you think about Parkland patient population, again, an example of breast cancer, our rate of late-stage breast cancer diagnosis is 2.5 times higher than the national average. And then this speaks into how do you go about to do a screening in the community, knowing that there is so many barriers for our patients. And we are so excited about another opportunity, a collaboration between, funded by the National Breast Cancer Foundation, Genentech, and the Parkland Center for Clinical Innovation. We're looking to figure out what are the patterns, what are the denominators, what are the, historically, when we look at population, we look at the zip code level, and that is too large of a denominator because, again, even within a zip code, there's going to be so much heterogeneity. So this is going to inform us about how we can develop the strategy to better screen our patients, because at the end of the day, the best thing that we can do, not every cancer is going to be preventable. If you can catch it earlier, there's going to be better outcomes. So this was, again, I want you to know that this is, again, it's only possible because of your support. And we very much appreciate it. And, this is not only going to help Parkland, but also we're going to be sharing these findings with other institutions that are in the same boat, Harris Health in Texas and even beyond Texas. So this is going to be a gift that we'll keep on giving.
Appreciate you sharing that context and information. And truly, it is important to know that even in the midst of such challenge and struggle, as you mentioned early, that there are bright spots and that there is a role that Parkland can play to continue to educate and inform, certainly advancing wellness and relieving suffering, which is the core of our mission as an institution. So thank you so much for those comments. Susie, I would love to turn to you and ask if you can share a little bit about your experience with Parkland and the cancer program, and certainly your role on the Patient Family Advisory Committee and how Parkland has worked to listen and incorporate the feedback that you and the committee have provided into its approach, much like we discussed earlier.
Thank you. I'm going to first say I am not your typical Parkland patient. I recognize that. But I, as director of a small nonprofit, I ended up without health insurance. And I went to actually UT Southwestern and had a mammogram and was diagnosed there. And they're like, we don't have a way to really support you. So they referred me here. And I was able to get basically the same treatment, only here. And my experience has been pretty fantastic. Not only is the staff wonderful, I am in some online groups, and so I'm comparing, experiences of treatment and, treatment plans and various strategies and things like that. I feel like I have a strategy. Sadeghi's my oncologist, by the way. But I do feel like I have a strategy that is aimed at keeping me alive a long time. I was diagnosed pretty much quickly as a metastatic breast cancer case, so I'm late stage, right off the bat. But the way, scans are used and treatments are used and addressed, I feel like I'm getting the best care I could get. So that has made me really confident in having a really long life, and I'm 6.5 years in already. And I'm gonna say something just about the approach. I don't know if every oncologist does this here, but I was never given an end date. A lot of women are told you have 2 to 5 years. You have 6 months. I was never told that, and it has made a huge difference in my mindset going forward. So I tell everybody that it really makes a big difference. Being on the Patient and Family Advisory Committee has been really fun because I've actually gotten to know other patients that I would not have known. We come from a variety of different places, cancer experiences, and opinions. And we get together every quarter and provide input. For example, we gave input on art that would be upstairs on the 3rd floor, and the snacks that are available to people who are there for infusions. The little things that really make a big difference when you're there for 6 hours for an infusion and you get hungry, and maybe you're not in a position where you are prepared to bring food with you. There's snacks, there's water, there's juice, and it makes a difference. So we've done various things with, activity schedules and the wig room, and so you're enabling the patients to have a voice in this process. And if there's something that comes up that we have an experience with, it doesn't work right or could be better, we have a way to let the staff know. And so sometimes these ideas come from the oncology staff, the nursing staff or whatever, and then comes to the PFAC, and then kind of gets decided together. So it's a really fantastic experience, honestly.
Susie, I thank you for sharing that. We think about in the medical profession, healthcare, we talk so much about trust and how do we build trust and sustain trust. And certainly creating spaces for agency and agency building is really important. And so kind of hearing about the ways that our patients are able to elevate their voices, irrespective of background and circumstance, but feel that they could be a part of this journey is really empowering. And I'd also add, just listening to your comments, this notion of intentionality, art and light and, the building design is, part of the healing journey. And so certainly the intention around how this edifice was constructed, and then food, and how making sure that we can address those barriers that may exist is really important. So thank you for sharing that. Dr. Sadeghi, I want to pick up on that last point around barriers. There's a lot of talk, certainly in Texas and across the country, about non-medical drivers of health, also known as social determinants of health. And we know that many of our patients, as you mentioned, in terms of our overall patient population, face those non-medical drivers to care, whether it be transportation gaps or lack of access, food insecurity, lack of childcare. We'd love if you can share the ways in which Parkland is working and works to reduce those barriers, and how partnerships with community-based organizations and companies like Uber Health is helping us reach kind of under-resourced areas throughout our community, particularly I would say in Southern Dallas County, where we know many of our patients reside, and we're working to build infrastructure that has not always been there, or investment that has not always been there.
So there is this famous saying that one of the most significant determinants of health and longevity of an individual is their zip code, and it's the sad truth. And I think that I would encourage, for those who are curious, later Google food deserts in Dallas, and you will see a map, and there's a definition for food desert, and how sad it is that we are in a metropolitan area and then we have these food deserts. Similar issue with transportation, that if somebody cannot afford their own transportation, they don't have the means. Again, imagine a cancer patient coming to an appointment or leaving from an appointment after receiving chemotherapy. And just imagine that person has to get on a dark bus or change dark lines in order to get to their destination, right? So it's true, these non-medical drivers play a very important role in care of the patients. And to that end, there are things that, and again, this is where philanthropy also comes in. So there are things that we can do at Parkland. Like, for example, we have contracted Uber Health in order to make sure that we can provide transportation to and from appointment to our patients. And it's actually, even before that, we were arranging for cab rides. But Uber Health has made it a little bit more organized to the point that you can also know if your patient is on their way to their appointment, so wait for them, make some arrangements, so on and so forth. The other thing is that also this is partially philanthropy supported, that we develop the infrastructure in the clinic so we have people who are informed about what resources are. If Parkland doesn't have it, does somebody else have it? And then how can we make that connection? Again, I don't want to go through the long list of all sorts of things that patients would need, from food insecurity, housing insecurity, from the behavioral health resources, which I'll come back to it. But again, we develop the infrastructure so that we can make sure when patients come to us, we formally assess all of our patients. This is actually becoming universal at Parkland, not only for cancer, but all diseases, chronic diseases, to assess the patients for what are these non-medical drivers of health or health-related social needs, and then try to systematically address them and connect them to resources, follow through, make sure that they made the connection. Has this been adequately addressed, or are there additional steps that need to be taken? And I want to go back to the issue of behavioral health. Cancer diagnosis, unfortunately, it has become so common that everybody knows or has been affected by it one way or the other, and it's a situation that is not only affecting the patient, it affects the family unit and everybody that surrounds the individual, right? And to that end, I can't even imagine when somebody they don't have insurance, they don't have housing security, they have single mother that is diagnosed with a cancer, they don't know what's gonna happen, the stress that is related to that. So another thing that we're very proud of is that we collaborated with the behavioral health at Parkland, the Global Behavioral Health Program, and developed the infrastructure so we can help our patients, whether it's in terms of counseling, other resources, so to be readily available to them when they need that help. So there is still a lot of work that can be done and should be done in this space, but I think that, again, these are things that we are proud of, because these things did not exist, and now our patients are benefiting. And again, to some degree, all of these efforts are supported by philanthropy.
Really appreciate just the insight in terms of the kind of creative ways that Parkland is aiming to address those social needs, in some cases using technology to screen patients, identify vulnerability in the community and proximity to resources, but they're not solely relying on that, but recognizing navigation is really important. How do we come alongside our patients and really help them understand how to make sense of what is complex, complicated, and can be daunting, especially in a moment of challenge. And so appreciate kind of the almost bifurcated nature in which we're trying to approach this. There's the human kind of side and navigation, trust building and support, but also leveraging other resources that we may have, technology to better understand and diagnose what the needs are, and then allocate resources accordingly. Again, we think about keeping the patient at the center, and how do we ensure that we are always elevating patients and making decisions that are in the best interest of patients. And Susie, I want to turn to you and really kind of ask if you could help us really help describe kind of the ways in which you may have seen the development of patient-centric innovations or interventions at Parkland. I think about uplift kits, which some of you may in the room have had the opportunity and privilege of building. Kind of how yoga, other support mechanisms, like how has that shifted, across Parkland, your time as a patient at Parkland?
I started treatment here when everything was in the other building across the street. And so being able to come over here to this space also has made a difference, because there's room for those things. There's room to have a resource center and yoga and things like that. So those decisions made a big difference as well in the experience. And getting a kit of something to kind of get you started at least makes you feel like somebody cares, that they know you're starting something really difficult. And it doesn't have everything, but for when you're coming and you're going to be there a while, fuzzy socks and a blanket, are nice. You can. I've used one of the. I think I got a tumbler, a travel mug thing in mine, and I used that for a long time. It was really great. So just something that says, "Hey, this is hard." But I think the other thing that I appreciate is the scheduling and the schedulers that are sensitive to the patient's world. Like, I tend to ask for something in the morning because it makes my day go better. For me to come to an 11 o'clock appointment, really, it disrupts my entire workday. It's different when I have multiple appointments, labs and an injection and a doctor visit. That's a little different, but if I'm just coming for an injection, I can usually get in and get out. And to be able to call or message and say, hey, can I change my appointment, or I'm going to be out of town. So for other people, it would be, well, I can get a ride at 10 o'clock, but I can't be there till then. Can I schedule? And so that sensitivity to the patient's world makes a big difference. It's not, in some worlds you think of the county hospital as a place that's not very nice, and it's not, you just are kind of a number, and that's not the case at Parkland College.
Yeah, I appreciate you saying that. I think both in terms of design of the buildings, but more importantly, the care, right, that is occurring within the buildings, and really being sensitive, as you said, to the needs of our patients. Again, going back to the community health needs assessment, we know that from the research, both quantitative and qualitative, that we've done, things such as scheduling, time of appointments, modality of care, they matter to our patients, and it impacts their health journey. So thank you for helping really elucidate kind of what is actually happening behind the scenes and the impact ultimately it has on the patient's journey here at Parkland. Dr. Sadeghi, I want to turn to you if I could. Many of us, I'm sure, have read periodicals, New York Times, Dallas Morning News, and we're seeing more and more a greater and increased kind of incidence of adults under the age of 50 being diagnosed with cancers. And given this kind of reality that we're seeing more and more, we'd love if you could describe kind of the preventative measures and educational efforts and initiatives that Parkland is aiming to implement and implementing to address these issues and trends that we see in Dallas County.
Before I answer that question,
yes,
I want to make a comment about also this idea of safety net system and resources.
Yeah,
and I think that, many think that, okay, safety net means that kind of just make sure minimum amount of support, maximum amount of, gain from that. And I would argue that, again, sometimes people think that, well, you don't necessarily have to have the same infrastructure as whatever private place may have. And I would argue that the patient population that we take care of has such a high level of need that you need to go above and beyond what every other place has to be able to compensate for that. Again, imagine that, for example, at our Simmons Cancer Center across the street, I don't know, if I had to estimate, maybe 5% of people may need transportation support. You come to Parkland, 30% of patients would need significant support. So again, you can't say that just because we are within a safety net system that we need to cut out the resources that are available to patients. The issue that you brought up about the cancer in young patients, this is actually this is something that we have noted for quite a bit of time, that particularly at Parkland. As a reminder for the audience, the 2016 United States Preventative Task Force recommendations about breast cancer screening was that start at age 50 and do it biannually. And then maybe at age 40, you can have a discussion with the patient if they want to or not. But for the most primary care physicians, you would ask them and they would identify that the recommended age is 50. So our Parkland data shows that 30% of our patients are actually below age 50 with breast cancer. 12% of our patients are 40. So even the 2024 recommendations from USPSTF that you can start screening at age 40 is still, you need to figure out again what fits our patient population, right? So for the same reason in the years past, we intentionally chose to follow the guidelines set by American College of Radiology and the National Comprehensive Cancer Network to start screening at age 40 and do it annually. I bring up the issue of annually because again, this has been our observation that we have a high incidence of interval breast cancers, which means that when somebody develops breast cancer between two regular times for their screening, in other words, before they're due for their next screening, they develop breast cancer. Same thing applies to many other cancer types that are quite common. So the age, for example, for colorectal cancer screening now starting at age 45. Now, in terms of what Parkland is doing to address this is the close connection that we have with our COPC locations, with our primary care infrastructure, to make sure that we're all aligned in terms of when the screening should be started, how should it be done, so on and so forth. And the other part is that Parkland has very deep roots in the community when it comes down to our community health workers, education efforts, alignment with the city health department, and all sorts of outreach programs in order to educate the public about what would be the appropriate age for screening and what are the measures that can be taken potentially to reduce the risk of cancer. Not every cancer is going to be preventable, obviously, but again, at least we invest on. I think that ultimately, again, if you think about this, it's about the health of the community in general. And I think that Parkland has made significant investment, continues to make significant investment, as exemplified by the new locations that there are going to be outpatient primary care, just to make sure that our reach expands and we get to the patients that need our care.
Yeah, appreciate Dr. Sadeghi, you talking about the work we're doing in the ambulatory setting in the outpatient space. Some of you have been to our Cedar Roman Health Center, which is in the Redbird community in Southern Dallas County. And that's a unique location for us, given how Parkland as an anchor institution was part of a larger economic revitalization effort and providing those resources and wraparound services to our patient population. We're working on a new health center in partnership, co-locating our 30,000 square foot health center on the regional campus of Dallas College. And so Northeast Dallas County, which is an area that increasingly has presented a variety of health needs and creates a space where we can, certainly through outreach, education, and access to compassionate and high quality healthcare, can begin to fill those gaps. And so one of several levers that Parkland pushes and pulls on in its care strategies. Susie, we've talked a lot about kind of patient voice and agency. And if I could, I'd love if you could, based on kind of your reflections of your journey and experience, kind of talk about the approaches that Parkland has taken to really integrate and incorporate kind of family voice and patient voice into decision making and cancer care planning.
I think the holistic approach takes into account the person and the disease and the family altogether. And I don't really have a good before and after kind of perspective that I know as I've been here for all of my treatment. There have been continued kind of efforts to create those spaces and kind of hear those voices that I would not have expected, from Parkland before. So I am a huge advocate of Parkland Oncology. You haven't said that yet. I tell people all the time, you need to be either UT Southwestern or Parkland for cancer.
Yeah, I appreciate that. I will be selfish because I'm a Parkland employee and bleed purple. We champion, but certainly work with our partners at UC Southwestern in all seriousness. And, but I do think it is important, to your point, around creating spaces where we can actually invite voices, but then do the equally important work of listening. Because you can invite voices, but then not actually listen and incorporate their feedback. And so I think it's imperative for Parkland and any health institution for that matter, to both create the space, but do the work of activating those ideas and finding ways to incorporate it into the care plan, particularly I would say in a healthcare setting. So we're going to put hopefully the QR code on the screen. There we go. And so I would encourage you, for those who are in the audience and have access to your cell phones and devices, to scan the QR code that is located on the screens, so that you can submit questions to our panelists. And so as we wait for that technology to do its magic, I want to ask a question for both of you, and that is really for you both to describe a moment when you really witnessed the impact of Parkland's cancer care efforts. That could have been outreach, it could have been support, it could have been innovation, just a moment that really stayed with you personally.
Well, I would tell you a moment that stayed with me and kind of made me move in the direction of doing what I do now. So when I started at UT Southwestern as an oncologist over a decade ago, I had clinics at the Cancer Center, I had a clinic at Parkland. And there were two interactions that happened in very close time proximity that kind of, it was very impactful to me. I was seeing a patient at the Cancer Center, and we were talking about what happened between their visits after they finished their treatment for breast cancer. And the patient talked about, oh, they had a wonderful bicycle vacation in Italy, and it was very refreshing, so on and so forth. And it was actually a really good thing that, to have that opportunity. And then the other side of this was that a woman at Parkland who was struggling with the idea of how can I have a mastectomy? She had right breast cancer, she was right-handed, and she was housekeeping. And so how can I, as a single mother, go through this process knowing that I won't be able to work, and I have kids, I have expenses, and I think that this makes Parkland such a unique place that I can tell you ask any doctor, they would say that when they are in private practice, when they have to deal with insurance, making phone calls, prior authorization, argue over treatments, and you come here and you don't have to worry about that. That, okay, does the patient's insurance allow you to do this one extra procedure that they need? That has made this such a privilege and a rewarding experience. And I think that, and I'm not saying that about me, everybody who comes and works at Parkland, we are a group, we are over 400 people who are taking care of cancer patients together. That includes over 100 physicians and trainees, over 100 nurses, our clerical staff. People who come here, this is not just, a day of work for them. It's more than that, and it's meaningful. And I think that that's the moment that stayed with me.
So thank you for sharing that. Susie?
I don't know that I have one moment I can point to. There could be one, but one of the wonderful things about being on some of the treatments I'm on is extra level of brain fog. And so sometimes I just can't recall a thing that I might want to. But I think the idea that everybody is a patient and everybody matters. It doesn't matter where you come from or who you are. you're gonna get cared for at the same level that everybody else does. I'm not getting anything else that someone else is not getting. We're all here from our various backgrounds and our various places. And I actually think being here and being in the midst of this diverse population of not only providers but patients, it's made me a better human in terms of understanding how to interact and the life of people who don't come out of the same privilege that I do, and I don't just in general for being a white middle class person, understanding better what some of those struggles are, but it doesn't make a difference when we're all cancer patients. You know, we're getting the same level of care. And I don't think that would be true everywhere.
Yeah, I appreciate you sharing. Thank you both for sharing those experiences. I would encourage those, especially who are Dallas County residents, because we are a taxpayer-funded institution, to, if you have not done so, come visit. I mean, you're certainly doing that tonight, but whether it's New Parkland Hospital, whether it's one of our outpatient settings, I think it's important for you to have the opportunity to kind of experience kind of how your dollars are being used and the environment that we've created that truly does, at its core, focus on patients and not preferencing one patient group over the other, but really treating everyone as a patient that deserves high quality, compassionate care. So thank you for sharing those points. As we continue to gather questions from the audience, Dr. Sadeghi, if I could go to you and really ask you to opine on the future of cancer care. What is the future?
I guess if I were that smart, I would make some good investments. Well, I think that this question, you can look at this question from so many angles. But I would tell you the future is definitely bright. I mean, we continue to make advances in treatment of cancer, better outcomes, better drugs, less side effects, better quality of life. So this is great, but it comes at a cost. And cancer care is already expensive. It's going to get even more expensive. Almost every drug that has been approved, and I'm talking about cancer treatment, oral agents, pills, that have been approved in the past decade on average cost over $100,000. So and then nowadays the treatments are just combine things together to get better outcomes. So again, outcomes are going to improve, but again, it's going to be at the cost of spending more money on every patient, and then thinking about this from the perspective of sustainability. I don't want to get to the point to the discussion about healthcare expenditure in the United States and stuff like that. I'm just looking at it from the perspective of an institution like Parkland. Parkland does a great job at collaborating with pharmaceutical partners and their charity programs to secure free medications for our patients, and pass on that saving directly to the patient, avoid financial toxicity. And again, the money that we have, then this is going to work more, right, for more individuals. But I think that we need to be very mindful of the sustainability of this. In the long run, policies change, even companies change their approach. So that's, I guess, my spiel about what's the future of cancer. But I would tell you that I think that our future is going to be investing at primary care and early detection of cancer. It's going to be cheaper. It's going to be having better outcomes. People are going to have longer lifespans, so on and so forth. So it's not just one thing, and again, that is why it makes it so exciting at the same time, and so much opportunity to kind of develop new programs that can bring all of this together.
Dr. Sadeghi, if I could stay with you. First off, thank you so much for your questions. A lot of great questions in limited time, so we're going to do our best to get through. It's a question around whether you can share some information about breast cancer prevention care, self-screening, and specifically, when should someone seek care? Should they wait until something feels off, quote unquote? Just any guidance, generally speaking, that you could offer.
Definitely do not wait. So I would say that, as I mentioned, the guidelines that we follow are the recommendations from the American College of Radiology and the National Comprehensive Cancer Network, starting screening annually at age 40. That is for individuals who are at average risk of breast cancer. Breast cancer is very, very common. 1 in every 8 women will develop breast cancer, statistically, somebody, right? So just we need to be always mindful of that. And I think that this is why it is so important to invest on, even the voice of the primary care physician takes care of one person at a time, right? You, us, everybody, we have our social circles, and this is how we need to be ambassadors to pass on this message that the screening needs to start timely, be done regularly. There is actually good research that has shown consecutive, consistent, regular screening. That's where you get your most benefit from doing this. It can't be that, okay, I'm gonna have a mammogram this year and okay, it looked good, let's come back 3 years from now and see what happens. You have to have it regularly. There are a different set of guidelines for people who are at above risk, high risk patients. So high risk patients, I guess the very, very quick summary of it, one would be individuals who have a family history of breast cancer. And I think in those situations, there needs to be discussion with the primary care to see the appropriate age, to see if they need to have genetic testing done, to see if there is a familial component, particularly in women who have history of young relatives being diagnosed with cancer. So when it comes to Parkland, we're proud that one of the services that we have is that we have a particular clinic for our high-risk patients. These are patients who either have a family history, a particular genetic mutation, they have had a biopsy that showed a particular type of change in the breast that is not cancer, but puts them at a high risk. And there are different ways that you can deal with this. From a close monitoring, so some patients would benefit from having, for example, every 6-month assessment. Some patients benefit from alternating between having a mammogram and a breast MRI. And again, remember, we're talking about high-risk individuals. So close surveillance is an option. Chemo prevention, which is a misnomer, it has nothing to do with chemotherapy, but there are medications that can be given to individuals to reduce the risk of developing cancer in the future. Ultimately, in patients who have very high risk of breast cancer, such as those who have the BRCA mutations, the risk reduction that we offer to our patients is that they could have mastectomy and reconstruction to reduce the risk of breast cancer.
Before we close out, a couple more remarks. One question that came up, and I personal privilege to have to ask Dr. Sadeghi. Your coat says UC Southwestern. It appears that you've chosen to practice at Parkland. The audience would love to know why. Why have you made that choice, given kind of where you could be practicing?
So I think there are a couple of points around this. One is that I think that again you need to be where you can be happy, and this is where my happiness is. It's very rewarding to be able to. You have to have this type of interactions to see how much of a privilege it is when you are. People who have means, they can go anywhere they want to receive care. When you think about that this is the last stop, this is where, and if I really believe that I am here to help somebody else, this is the place for me. And I think that, again, I don't want this to be interpreted in any way that, other people who are elsewhere are not doing a good job. This is just for me that I really believe that for me to prevent burnout, to be able to, continue to do my work, I need to be where I'm happy. And this is my happy place.
We are happy that you are here, and we are grateful for all that you do, including being here tonight and helping us really better understand the complexities of cancer and cancer care across our community, but the innovative ways that Parkland is seeking to improve care for so many, especially our most vulnerable. And so thank you, Susie, for elevating patient voice, for championing the work of Parkland, and being an advocate for what is happening across our community. And so I would ask if you could please join me in thanking again our distinguished panelists. As we conclude our event tonight, I want to also take the moment to thank our sponsor, Park Place Motor Cars, for supporting this event, helping to make this candid conversation possible. So thank you to Park Place Motors. And finally, I want to thank each and every one of you tonight for being here. These events are really designed to educate and inform our community about the great work that is happening across Parkland, to in some ways demystify and or create a counter narrative around the great work that can happen in a county hospital district such as Parkland. And so I would encourage you to do a couple of things before you kind of head out to your final destinations or next destinations, because I guess the night is still young. One, please tell a friend, tell a coworker, tell a colleague, tell a neighbor about what you learned. Share the information. It's important, right, for us to build a community of advocates. And the best way to do that is through education and information. So number one, share what you learned tonight. Number two, I invite you to please come back, visit. Take some time to tour the facility here, certainly our new hospital, which is soon to celebrate 10 years of existence, to attend visit one of our outpatient clinics. It's really important to be on site, to really kind of hear and feel the culture, the operational flow, and see the interaction between our wonderful staff and our patients. And then finally, I'd be remiss if I didn't acknowledge the fact that it does take public and private dollars coming together. We are grateful for many of you in the room who individually and certainly through your institutions have and continue to support the innovative practices that we discussed tonight, whether it's through registries and colorectal facilities, or whether it's through testing and screening and providing access to childcare and transportation and food. So many ways that philanthropy continues to show up and really fill in the gap that we know exists across our community. And so certainly a member of the Parkland Health Foundation team will be happy to discuss ways in which you can support those efforts and be part of a phenomenal and growing community of supporters here at Parkland Health. And so thank you so much. I wish you safe travels and look forward to our next installment of our Health Matters Candid Conversation. Thank you.